morning to everyone. I am Vani, Assistant Professor and HOD of Fundamentals of Nursing from Sri Devraj Aras College of Nursing, Tamaka, Kolar, Karnataka. Today, let us discuss about the procedure of intramuscular injections. Let us see the definition of intramuscular injection. What do you mean by intramuscular injection? It's nothing but an introducing medicine into the muscle in the form of a solution. What is the purpose of providing an intramuscular injection? To obtain a quick effect of medicine than it is obtained by the oral administration and subcutaneous administration, and by providing IM injection it assures that total dosage will be administered and will be absorbed for systematic action of the drug. The medicine which is not suitable for intravenous administration also can be provided IM injections. And what are the principles of intramuscular injections? First principle to follow: never use expired drugs. Follow the rights of drug administration. Make sure that patient is comfortable and always give a test dose in case of penicillin administration. Select the appropriate site for giving injections. Use correct technique of injection by following needle inserted gently, quickly, and the drug injected slowly. Document the procedure with date, time and signature. Coming to different sites of intramuscular injections. There are different sites of intramuscular injections such as dorsal gluteal site, vastus lateralis site, as the images are displayed. Dorsal gluteal site is like find out the greater trochanter of the femur and posterior superior iliac spine, which is drawn on an imaginary line between these two bony prominences site, will be an upper and outer quadrant. Vastus lateralis site, this site can be selected at the outer aspect of the thigh. It is the area between the mid anterior thigh and mid lateral thigh, one hand span from the elbow and greater trochanter to one hand span above the knee. Ventrogluteal site, how to locate it is: place the tip of the index finger on the anterior superior iliac spine of the patient, the middle finger just below the iliac crest. Mid-deltoid site, locate the lower edge of acromion process and form an rectangle. The deltoid area is used to inject very small quantities of non-irritating drugs. Now let us see the demonstration for intramuscular injection. First, before going to start the procedure, let us see the nurse's responsibility of what need to be checked. Check the diagnosis and age of the patient, the purpose of injection, check the doctor's order, check the patient details, and check for any allergic reactions of the medication. After ensuring this, let us move for the equipment or the articles required for the intramuscular injection procedure. A tray containing sterile gloves, syringe and needles of various sizes, sterile cotton swabs and gauze pieces in sterile container, drug order sheet, water for injection, and a puncture proof container. So, let us prepare the patient and environment, identify the patient correctly, explain the procedure to the patient, provide privacy, place the patient in a comfortable and relaxed position, and select the site suitable for route of administration. Now let us move to the procedural steps. Wash hands, as the demonstrator already washed the hands. So now moving on to the step of donning the gloves. Now after donning gloves, prepare medication from ampule or vial. Once the medicine preparation is done, select, locate and clean the site. Select, locate and clean the site by locating the exact site for injection from acromion process to 3 finger width. Remove needle cover without contaminating the needle by pulling straight off. Inject the medication Grasp and pinch the area surrounding the injection site. Hold the syringe between the thumb and forefinger in a pen holding manner. Pierce the skin at the site of a 90-degree angle and insert a needle. Aspirate by holding the barrel steady with non-dominant hand and pulling back the plunger with your dominant hand. This step is done to confirm the location. Withdraw the needle. If blood appears in the syringe, discard and prepare new injection. Inject the medication slowly and steadily if blood doesn't appear in the syringe on aspiration. Withdraw the needle slowly and steadily while supporting at the hub of the syringe and needle with non-dominant hand. Support the skin surface. After injecting the medicine, never recap the needle. Just do the in a puncture-proof container. Discard the needles. At the site with a drug sponge, and if bleeding is present, continue applying pressure. Never massage the area immediately after the injection. Replace the equipments in proper place. Now let us see aftercare of the procedure. Help the patient in dressing up. Ask the patient to take rest for 15 minutes. Check the limb movements to confirm there is no nerve injury. And watch for signs and symptoms of allergic reaction. Record the procedure on nurse's record. After documenting the procedure on nurse's record, replace the equipments in a proper